Good evening. Welcome to Elevated, a show that brings you inspiring stories for visionaries and change makers who are transforming lives. I'm your host, Susan. Today's topic, it's one that touches the hearts of many. Hope and health, empowering sickle cell fighters. Joining me is Mr. Okello Isaac, the founder of Raising Hope International Friends, a foundation that is dedicated to giving out free screen services for sickle cell fighters and raising awareness for sickle cell fighters. Welcome, Mr. Okello.
Thank you. Thank you so much for having me here.
I'm so happy to see you. How have you been?
I've been okay. Thank you so much for hosting me.
It's an honor to have you.
Yes.
Well, who is Mr. Okello Isaac?
Thank you so much, Susan. My name is Isaac Okello. I'm a sickle cell advocate, and by profession, I'm a public health specialist, and also I have a training in marketing. So, and also, I'm a married man of three.
Three children?
Two beautiful daughters and one son.
Wow.
So, with one wife. So I'm very happy to be on this show.
Well, you're welcome.
Yes.
You talked about sickle cells, and today we're tackling sickle cells. For someone out there who doesn't know what sickle cell is, kindly take us to what is sickle cells and how does it affect people that have it?
Thank you. Thank you so much for choosing sickle cell because it's an area that has not been amply addressed in Uganda. And when you talk about sickle cell disease, we are talking about an uncommunicable disease that affects people who have the sickle cell trait actually give birth to children with sickle cell disease. So sickle cell disease is when one is born with two abnormal red blood cells. Ideally, for you to have sickle cell disease, it means that both parents carry the traits, okay? The trait is when you have what you call one HB abnormal, whatever, recessive in the body. Then if you have the sickle cell trait, now the parents, the mother and the father, carrying the sickle cell trait, actually pass it on to the children, and that's when you get sickle cell disease. And oftentimes, many people confuse the carriers and those who have sickle cell disease. For people who have sickle cell disease, they're actually sickly, oftentimes, but for those who carry the trait or who are carriers of sickle cell gene, they don't manifest with any sickle cell signs and symptoms. Basically that, yes.
How does one become a carrier?
How does one become a carrier?
Yeah.
Let me take you back where sickle cell really comes from. When the very first research that was done in 1910, when most of us were not actually born, you find that sickle cell disease rotated around sub-Saharan region where malaria was so endemic. Okay. And you find that even those now have sickle cell disease, you realize that their origin of sub-Saharan region, let's say Caribbean Sea, let's say Indian, those are areas that are prevalent with sickle cell disease. So they are affected. And you find that anyone who is out there, they are attached to these regions I'm mentioning in the whole world. So how is sickle cell, how can you tell that someone has sickle cell trait, or where did they get the sickle cell trait? In a simple way, because of the body immunity fighting against the malaria parasites, okay? You find in 1910, when the research was done, you realize that our bodies were trying to fight against this malaria parasite. So in return, they actually the blood cells sickled, okay? And some that did not sickle, they just carried what we call a trait, okay? Now, from there on, areas that have been having malaria endemic, and from way back, they have sickle cell disease. We have gotten many people who come up, having sickle cell trait. And just to emphasize, sickle cell disease is genetically inherited. So it moves in the bloodline. You cannot acquire it. You can only get it if you plan to have, or you have an intention of having children. And both of you are carriers of this gene. Yes.
So if a carrier and a carrier come together,
yes,
can they give birth to a sickler?
Yes. actually, the study shows that when two carriers get married or they marry each other, there is possibility of getting 50% of their children being carriers, and 25% having their children who are sicklers, and 25% normal. So there is that possibility of giving birth to normal, children carrying normal hemoglobin, and those ones who are carriers and sicklers. Yes.
Mr. Okello, what motivated you to start up this foundation?
Thank you so much. I have a very close relationship when you talk about sickle cell. Way back in 2016, I happened to receive a call from one of my aunties, and she was trying to explain to me what her son was actually going through. She actually told me later in the night that Franco, we used to call him Franco is actually very sick and is in the hospital. We need money so that we can get blood, because the doctor has advised to do blood transfusion, saying what's the cause of the blood, anemia, which needs transfusion. So she didn't explain to me. So I had to send her money. And in the morning, the kid was actually pronounced dead. Just like that. We didn't know exactly what happened. So later on, the doctor suggested to do some tests just to confirm if this child might have died of sickle cell. So she did a test, but then she went ahead and asked the hubby to take a test for sickle cell. And the husband said, no, we don't have sickle cell. I don't know, why should I even take this test? Just like it has been some narrative that we just need to change around the public. Sickle cell is genetically inherited, and both partners contribute to sickle cell disease. So he did not actually take the test immediately. After some time, a year later, she did a test, but not knowing that by the time Franco was dying, they were actually expecting.
Oof.
Yeah, so that was 2016. Yeah. So in 2017, around the same month in June, the time Franco died, we received a beautiful baby girl. And that baby girl was also diagnosed with sickle cell disease. So my auntie
was a carrier.
A carrier. Was found a carrier, and the hubby was also tested after this second baby was confirmed that she has sickle cell disease. He was confirmed a carrier. Yeah. So both of them were carriers. So you can see now we have lost Franco. We have the second baby. I'm telling you, this kid never lived even for a year.
The baby?
Yes, the baby girl, the second born. The second born died at 8 months.
Oh dear.
So in 2017, I took the initiative of bring on different other stakeholders to discuss about this matter and bring awareness to the community and provide screening services, something that has not been there. And you realize it's because of our voices that we speak out there. You see, today we are having prescription for sickle cell coming through. We are seeing attention given to sickle cell. We are seeing international community coming through to support the sickle cell work that we are doing. So that is how I relate with sickle cell. It's in my side, maternal side. Yes, sickle cell is there. And we have actually the third born to the same auntie of mine who has sickle cell disease. So, but this one here, we started early now because I've been in this space. We've been trying so much to help him to ensure that he lives a pain-free life. He's actually making 5 years in the next 2 months. So you can see sickle cell. When we talk about sickle cell, I know what it means. I know how my auntie has actually suffered with raising this kid, because Franco was making 5 years, he died. This baby girl in just 8 months, she was nowhere to be seen. We are now having Elijah. Elijah is making 5 years, and we are very happy that he's living a healthy life, and something that we need to advocate for good care, good clinical support for children living with sickle cell in Uganda. Yes.
Okay, based on what I know about sickle cells, or the few people that I have been with who have suffered with sickle cells, I've come to realize that people who have money usually raise their children up to maybe up to a certain age, unlike people who don't have money.
Yes.
How true is that?
I should say that is just a narrative.
Okay.
Because sickle cell is so unpredictable. Let me just take you back to, the national burden of sickle cell. As we talk about this, it would be ideal to talk about the national burden. As we speak today, Uganda registers between 20 to 30,000 children born with sickle cell disease every year. 20 to 30,000 children who are born with sickle cell disease every year. Wow. And what really, perturbs my mind is that over 80% die before the age of 5 years. And do you know why? Because some of them are diagnosed and they're put on care. Some of them are diagnosed late when, the system has been compromised and they cannot really, fight on. And many of them are not aware they're actually raising children who have sickle cell disease. Back to the narrative of those who have the monies, they can afford, they can get proper care and so forth. I should say partly yes, partly no, because sickle cell is very unpredictable. We've seen many who have been on hydroxyurea, which is an essential drug for management of sickle cell for quite some time. They have not had any attack, any sickle cell crisis. They get it one day and the next day they are pronounced dead. And that's why today I wouldn't, I would really wish to advocate for really cure for sickle cell. Because when you look at HIV, they are living healthy.
Yeah.
No one is going to, no, exactly. But for sickle cell, someone who has been on proper good care, they actually die when you less expect them to, to die. You understand? Yeah. So, care is actually very paramount. It's very needed for people living with sickle cell disease. Both home care and clinical care is much needed, and we advocate for it. The more they actually get good care, the longer they live. You understand? So money aspect can actually come in, but then you can have money when you cannot even care for them. True. You understand? Yeah. So we just need to care for them. We just need to love them. We just need to give them all the attention they need, all the support they need, psychological, financial. Because after some time, we've seen a number of, warriors, sickle cell warriors, the fighters, come to us, asking us to talk to their parents. When they become teens, teenagers, some parents, abandon them. Yes, they are left and they need support, they need mental health support, you understand. Some of them, some of their parents feel they have given, they have supported enough, it's just too much, they can't contain it anymore. So it's a story that we need to come together and say, hey, can we just embrace them? Can we just love them? Can we give them the care and the love they deserve? Yeah.
But you talked about children who are born in families and the parents don't know that this child could be having sickle cells. What are those quickest signs that someone can look at and is like, okay, I think my child has sickle cells?
Yeah, one of the things we need to look at when you want to check for sickle cell, one, yellowing of the eyes. Oftentimes, children who are born with sickle cell disease, manifestation of these signs and symptoms come between 4th month, 4th to and above. You'll at least tell this kid could be having sickle cell. Yellowing of the eyes, they're always sickly, okay? And then you will also experience swelling of the fingers.
Oh, really?
Yeah. We normally, commonly, we call it sausage-like syndrome. You find the fingers are swollen, and when you touch on them, they are very painful.
Oh, really?
Yes. And also having anemia, lack of blood, because that is one of primary indicators that they could be having sickle cell. Oftentimes, when the red blood cells die off, replenishment of new red blood cells becomes hard, and they get into a crisis. Yes, and also getting frequent infections.
Oh dear.
Yes.
Okello, you talked about you've been in this system since 2016.
Yes.
Are there some stories that you have heard or experienced, stories of certain people who have fought with this disease till now?
Yeah, we have actually many that we've touched as a foundation. We have many that we've supported. Like we have a whole package on how we can support those families that live with sickle cell disease. The biggest thing is acceptance, mental health, psychosocial support. They need it so much. If you don't really provide that, we are losing many children, and many families are actually abandoning children who have sickle cell disease. So we have many stories when you talk about stories around sickle cell. We have stories of resilience. We have one of our very own young man, Moses, who made 34 years.
34.
Yes, he's very healthy. He can share with you the story of resilience. He's working with one of the international organizations, and like as we are planning to have a conference very soon, we want him to share with us his experience with employment, because many of our sickle cell warriors have been sacked from their workstations because of their health statuses, because they cannot keep at work for even a month without getting a crisis. So we have many stories that we look up to. Yeah.
Share with us some of those stories, especially now when it comes to love.
Yes. Yeah. Now love. Oh my goodness, love is it's challenging for sickle cell warriors. I've handled a number of them. And I can assure you that just like, you meet someone and like, hey, have you ever tested for HIV? Definitely they'll say, yeah, I tested 2 months ago and I'm very okay. You understand? I mean, these are just words. You're not sure whether they tested for HIV.
Yes.
So, and also when you look at some of our warriors, you can, for us who have been in this space for, good time, you can tell, oh, this could be actually a sickle cell warrior. You understand?
You can tell?
Yeah, you can tell. So we have features we look at and tell. You understand?
Even before you do the test?
Exactly, yes. But that is just, an assumption, which you have to go and take a test.
Okay.
You get, just like I was referring to HIV. Someone will tell you, hey, but you look normal. You could be actually HIV positive. You understand?
Yes.
But then, because you said, someone may take it or may not take it. But then you have to confirm. So many of our warriors, more so the girl child, we have not so nice, stories to hear. Whenever they disclose to their boyfriends that, I have sickle cell and this is how I live with it, oftentimes they are left, without even any information why they left. They're just left in space, you understand? They're abandoned. They are not loved the way they would wish to be loved. You understand? So I think this also goes back to us, all the stakeholders. What are we doing to ensure that we create awareness, for sickle cell? You see, initially, we normally refer to the model of advocacy for HIV because initially people used to fear HIV people, you understand? And they were being stigmatized. The same thing if you reject a sickle cell warrior, they feel small.
Yes.
There is a way they feel, okay, it's because of her health status, you can't love her. You understand? So many of them have been, rejected because of their health, status, the sickle cell. And some of them have gone ahead to not disclose, their health status. Yeah, intentionally, because she feels she loves you, and you've already showed love to her. You understand?
Yes.
Interest. So she will definitely she will not disclose her health status. Now let me just share with you. There is a scenario. Some time back, one of my warriors was sharing with me. She needed some help, and she was telling me this guy, has been so good to me, and actually I'm expecting, but the guy is not ready to take a test. However, I did not disclose my status to him. You understand? Because of fear of rejection. It has been happening, so they don't want to keep the same thing. You understand? They want to be loved. And some of them actually want children. They want to give birth to children. They want to have their own. But they are looking at having,
a healthy baby.
A healthy baby.
Yeah.
Any mother, any parent would wish to have a healthy baby. You understand? So they are looking up to that. So if they are being rejected, what they resort to is not to disclose. They keep quiet. And what does this mean? For us as advocates, we're saying, hey, can we break the sickle cell cycle? If you don't disclose, we are not breaking the sickle cell cycle.
Yeah.
We're actually moving with the sickle cell itself. You understand? So that's why you and I have to know. We need to talk about these things freely. Yeah.
But do you think a sickle cell sickler, can find true love?
Oh yes, they can. We've seen many who have actually. We have. I may not mention the name. We have one of the oldest celebrated mothers, in town, who has 3 children. Three children, and she's happily married to date.
A sickler?
Yes, and she's 40 plus.
And the children, are they healthy?
They're very healthy. Yes.
Okay.
We have these mothers here. We have fathers who have sickle cell. You understand? Yes, and they have healthy babies. And like I say, this starts from the point of saying, okay, we are planning to have children. Which direction do we have to take? We have to be very candid with each other. We have to be open. Yeah. Tell me, I tell you. If you have, let's go. If you have, or if you don't have, let's go and carry on a test. Okay. And you see, I normally talk about not being selfish. You and I being in love, and you forget about the joy of the baby who will come after. We may actually separate. We've seen many actually part ways because of the sick babies. You understand? So we don't want to create that kind of scenario. And that's why I say, hey, can we just take this test as early as possible? So that, hey, we don't get there like, hey, we were all carriers. We didn't know. Yeah? And no one has actually told us about this. So we are seeing many of them who are actually giving birth. Yeah? But then I emphasize so much, as you plan to, have children and you're a warrior, you are a girl child, kindly consult with your hematologist, kindly consult with your physician when you're undergoing that, gestation period, so that you can be supported and you come to us also, we support you. Yes.
Let me ask, a couple has gone for a checkup.
Yes.
They're both carriers.
Yes.
And they love each other.
Yes.
How would you advise them?
That is interesting. One of the things we do is to guide. We provide you with resources, with information, okay? But then to us, that is just not compatible.
So you tell them to separate?
We don't tell you. I'm just telling you it's just not compatible. When you look at the cross-match of the genes, they're susceptible of giving birth to children who have sickle cell disease. I've just given you a clear example of my auntie, whose hubby is a carrier and she's also a carrier. They have given birth to 3 children who are having sickle cell. You understand? So you realize that it all comes back to you as a couple. We will provide you with this information. Hey, this is what you should expect, okay? If you move on, this is what you should, expect at the end of the day. You understand? Yeah, so you just need to, we give you information that you need, then you go ahead and make a decision.
Yes.
Because, yes, you make a decision as a couple. As you came, you go back and make a decision. We actually have a comic, we have some comic books that we are distributing in schools.
I think I saw them on your website.
Yes, we have comic books we are giving, and it's actually related to the same. Yes, related to the same. So you look at it and like, okay, John has decided, but what has John decided with the girlfriend?
With the results.
So the results are out, and this is it. Please, this is the guidance we are giving you, so you take on the decision.
But would you advise them to part ways?
Maybe if you asked if I was the one, I will definitely tell my fiancé that, hey, this can't just work.
You would part ways?
Definitely.
Despite the love you have for each other.
You see, like I said, I will not actually choose love, on the expense of the joy of the baby we're going to give birth to. Because without the joy, there's no love.
True.
Without the joy of this baby, there's no love. With the joy of that baby, there is a lot of love. There is peace.
On average,
there is joy.
On average,
Yes.
in Uganda,
Yes.
how many people could be carrying the sickle cell?
When you look at sickle cell trait burden in Uganda, we are talking about 13.3 of the whole population. That translates up to 8 million Ugandans who could be carriers of sickle cell disease. And like you say, sickle cell disease does not communicate. It's a non-communicable disease. So you may not tell whether, you're a carrier, I'm a carrier, because we live, very healthy. However, for the sickle cell carriers, oftentimes they don't fall sick of malaria. Yes, they are kind of malaria resistant. They rarely, and this goes back to maybe those who are watching us this evening. If you have never suffered from from malaria for the last, let's say, 10 years, 15 years, please go on and take a test. What? There is possibility, 90%, that you could be having, trait. You could be a carrier. Yes, you could be a carrier. So please go on and take a test.
What? That is serious. I actually thought that, being a carrier, it's normal.
Yeah, it's normal.
To live life normally.
You're going to live. Being a carrier, you will be very normal, like very normal, but you not suffer from malaria. You understand? Like often, like sickle cell affected persons. You understand? But you live normally. Like I said, you and I, we look normal, but we could be carriers. We have many of them. They'll actually suffer from other diseases. Yes.
But not malaria.
But on rare occasion do they suffer from malaria.
Well, we're going to go for a short break and come back with more information about sickle cells.
Welcome to the Sunrise Show. My name is Angel Walker.
Erectile dysfunction is one of the causes of marital breakups. But do you know, we have a solution right here.
On the Sunrise, learn how to utilize your small spaces at home.
Don't miss every weekday mornings, the Sunrise, right here on Promise TV.
The devil is here on the earth doing stuff. When you call Jesus, Jesus comes into the situation and overrides and says, let that one go. So whatever the enemy is holding, whether you can't give birth, someone bewitched you that you can't give birth, or someone is just tampering with your star, someone is frustrating you in any way, whenever you come to a place where God is, Jesus does what? Overrides. He said, no, this one is under me, don't touch. And the moment you begin to have Christ in you and you become a witness, the Bible says you become a witness of his resurrection. Why? Because resurrection is the thing that defeats Satan.
Siriya tia mukologa ngo bulungi nyigida wesengenda James Tata Kane falukumi ya Pogba Mane Salah Mbappe la Kazate la bwa muziki nyingida bango gena juulira kukonkona kayimba ko kayimba akapia obukadde ani muyimbi ki yakoze ekivulu ngenda mukonyomeza nkunyumize ani go chata go kyasaze lwachi nsonga ki tubinyumyemuko kuchaliza abayimbi muyimbi ku muyimbi nata muyimbi ku muyimbi gatunyumya mwembozi okubene simu obeko kyobuuza okubene simu osaba kayimba ko yagala nge sangenda okanonkagala kakokone bwe kunyumirwa atenga tusanyuka atenga buoyiga lwakinedda kale bwe sawa 11 paka sawa eja emu yakawongezi nga kusibula nga kutya kanja kujja kengalo kusibudde
Welcome back to this other segment. Mr. Okello is going to tell us how sickle cells is distributed or is being distributed around Uganda.
Yeah, thank you so much, Susan. Sickle cell is widely distributed in Uganda. And before I can mention the burden per maybe region, let me just give you a snapshot of how it started and how it was in 1945, the very first research that was 1945.
Wow.
Yes, the very first, survey that was done in Uganda. It was done in Bundibujo, and you realize that area alone contributed to 45% of national burden of sickle cell by then. Okay. As you speak today, it has actually gone down because of the sensitization, encouraging intermarriages and so forth, which is not, also a case in other regions. Today, as we speak, Northern region has the highest sickle cell prevalence in the country, with over 19% of national burden. Then when you talk about still sickle cell, we have Lango region, Lira. It has over 17% of national burden, of sickle cell disease. Then Busoga or Eastern region has over 16%. So you realize that most of these regions are highly affected with sickle cell. And when you look at the malaria cases as well, they're actually high. Remember when I was talking about the relationship between sickle cell and malaria? The prevalence is also very high. Then it comes to Central, it's very minimal. When you look at Western region, it's actually in 0.9%. Yeah, so it's not as severe as it is in Eastern, Northern, and Eastern part of the country.
That's quite interesting. When you talked about those places,
So
when I get a partner from that, must we go for the test? Because
definitely.
there are chances these people could be carriers.
Yes, you could be a carrier.
But that doesn't stop us from taking tests because they're not from there.
Yes. Whether you're from the West, you're from the Central, you have to take that test.
Actually, I've never seen a Western suffering from sickle cells.
Oh, really?
Yes.
Because you've not
I've not traveled.
traveled, and also you've not gone to the hospital to see what happens there. Also now you can not only hospitals, but if you come to organizations like ours, we can confirm it affects anyone. It can affect anyone.
You took your organization, by the way. What does it really do? Like, where is its impact?
Thank you so much. Our impact is wide, and we've registered a number of achievements since inception. As Raising Hope International, we provide education and awareness about sickle cell. We provide counseling, like the traits. When you're tested, like in the camps, the outreaches you normally organize, and you have the trait, you're guided, you are advised, you're counseled. Many people think that when that test is reactive, you have the trait, that you're sick. No, you're not. So we have a team that is dedicated to, providing counseling for that trait. Now we also go ahead and provide psychosocial support, to affected families, to affected, people. Some that provide subsidized, sickle cell services. Yes. Then we also partner with the hospitals and provide some equipment that are supposed to run, and we procured a sickle cell point of care, and we installed it in one of our partner facilities. Now they can, have sickle cell screening, and as I speak now, there are over 80 children who have been under care. 400 have been screened, and over 80 were confirmed that they are under care. So that is what we are doing to ensure that we impact the community. So we have outreach programs that we are running in different places. Like I said, we do the education and screening, free sickle cell screening. We provide it in our community outreach programs that we are running.
I noticed that in one of the things that you do, you offer free screening services.
Yes.
Why is it that screening in other hospitals, it's quite high? The fee is quite high. We called recently one of the laboratories, and they were saying each person, they charge them 120,000.
Wow, that's exorbitantly high.
Why? Why is it that high?
Well, I don't know what they used to, what system they used to, compute their prices. But sickle cell test shouldn't be that expensive, and that's why we are having issues of, pushing for policy, for mandatory sickle cell screening and premarital screening and counseling. We need it to be accessible. Hospitals are charging differently. They have different formulas they use to come up with their prices. And also, they could be having different distributors of this reagent, so you may not really tell. However, the test for sickle cell shouldn't be that expensive. And that's why, as an advocacy organization, we want this test to be as accessible as possible It should be as affordable as possible. We want it to be, out there. And that's why we are providing it for free. Because we've been supported by the Minister of Health to ensure that, everyone is screened. So why not to leverage on this, services we are providing as an organization? So the government has done enough to ensure that at least we can have some kits and, provide screening services for the people.
How long does this test take? If someone, when do the results come back?
For now, we have point of care tests. It takes between 10 to 20 minutes. You have your results ready. And
What
that's
do you
what
mean
we
by
use.
point of care?
Point of care, it means like it doesn't take much time. Okay?
Imagine.
Like where you find us is where we test you from and you get your results.
Okay.
Yes. So when you go to the hospital, some take 24 hours, some take 3 days. Yeah, HB electrophoresis takes some time. Yes.
Oh, you say that the Ministry of Health, you're working together?
Yes, we work closely with the Minister of Health.
And are there other companies that you work with?
Yeah, we have other companies that we work with as well to support the sickle cell community and the program we are running.
International? Because I know it's still international.
Yes. Yeah, the international comes in play. We have international partners like the pharma industries that are supporting with research in Uganda, like Terumo. We have Novartis. They provide. Novartis manufactures the essential drug, the hydroxy I talked about, and they have a partnership with the Ministry of Health, and we work with them as a patient group, as an advocacy group. Yes.
Okello, there is that drug
Yes.
that the sicklers usually inject themselves. Yeah, and I know some of the drugs, actually, some of them get
It
addicted
is
to
actually
them.
restricted, yes.
Some of them get addicted to them. Have you
Yes.
seen some sicklers that have gotten addicted to this drug?
Yeah, we have some who are actually addicted, and they really hide whenever they are, injecting themselves with those drugs. Something that we don't really recommend, because when you talk about those opioids, they are restricted drugs. Pethidine, morphine, they are restricted drugs. They are just under lock and key. Yeah, so we don't encourage them to be used unless prescribed by a professional health practitioner.
And I've noticed that some sicklers have gone ahead. They know how to administer injections to themselves.
Yes. Now
Is
they
it
are nurses.
advisable?
They are good. They are good nurses because you see, when you stay in a space for so long, you actually get to learn and get acquainted to many things. So they are so well versed with most of their care. They can inject themselves. But it's not advisable though. They do it, but it's not advisable because they're supposed to seek for care, for any support, medical support from healthcare providers.
I think sometimes it gets really painful.
Yes, it gets. I know it gets. They can get that. Excruciating pain, like
Yeah.
very painful, experience they normally go through, and they feel like they just need relief. And that's why when you interacted with, a warrior or a caregiver or a parent who is raising a kid with sickle cell disease, they will tell you they are just desperate for solution to do away with the pain, to do away with sickle cell. You understand? So the most important thing they look at is how do we clear the pain, and also when you look at the guidelines with the health, the Minister of Health, one is how to curb the pain. Yes, pain can kill.
Sure.
Yeah, many have succumbed to pain.
Yeah.
Yeah, so you have to first, attend to that pain. Then you can now start treating, the cause of maybe the crisis. If it's anemia, if it's an infection, if it's malaria, so that can be handled after the pain has been attended to.
You said many of them want to get rid of the pain.
Yes.
Have you come across some who have tried committing suicide?
Oh my goodness, many of them.
Many of them.
Many of them. They will tell you. They call me Mr. Isaac. Others call me Papa. I am tired. I wish I can die. I don't want to be in this pain. So as they speak this,
You feel the pain.
you feel the pain.
Yeah.
I'm tired of this pain. I've been bedridden for 3 months. Someone has multiple strokes. They cannot walk. They cannot talk. They're just there. The only thing is to write to you, maybe if she or he can write, tell you that I want to die because of too much pain they go through. So many of them actually have thought of committing suicide. We say no, suicide is not the solution. You're a fighter and you're fighting and you're going to make it.
And there are those that have failed to, like, they've ended up committing suicide?
We've not registered any. Most of these, most of them have been, pronounced dead, in the hospitals.
Because of the pain.
Yeah, you may not tell if they try to do something. You understand? But then, when the hospital gives you a report that was maybe the patient came in a crisis, we try to stabilize. The pain was too much. Maybe the anemia was severe, and had the complications, and he passed on or she passed on. So you may not tell whether they tried to do something before they went to the hospital. Yeah.
But the few that have come to you because they wanted to commit suicide,
Yes.
how best have you talked to them out of this?
Yeah, we've tried to guide them and also advise, because committing suicide is not the solution. You're causing more harm to even those who are around you. So we advise them not to do that, but prepare them that, as a fighter, no one gets there until they fight now. You understand? You fight now so that you can get to... The solution to sickle cell is actually coming through. We are having new innovations like gene therapy. It was recently announced globally. Now it's available in hospitals in the US, though it's very expensive, but now the solution is coming. So the more we fight, the more solution comes closer. So the more we fight, the more research is being done, the more we speak about it. So committing suicide is also not a solution, and it's actually a sin.
Yeah.
It's a sin biblically. We know that. So we don't advise.
When you talk about the gene therapy?
Gene therapy, yes.
How does that work?
Now, this is science of supporting. Now, you see, when you look at sickle cell disease, we are talking about the bone marrows. So what happens, we've been having what you call bone marrow transplant, where we get healthy marrows from a healthy person who carry normal blood cells, red blood cells. We transplant it
To a sickler.
to someone who has sickle cell disease. We call them sickle cell warriors, so that they can now support themselves.
Okay.
You get, so that they can live a healthy life. So with the gene therapy, now we don't need
A marrow.
we don't need actually whatever bone marrow transplant,
Transplant.
we don't need whatever transplant or a donor. We don't need a donor. They use your own marrows.
Okay.
They modify them, to produce now normal red blood cells. So that's the science, that the new technology that is actually coming on board. It is kind of sophisticated, but very, very efficient.
They edify them.
Yes, they modify them.
They modify them.
Yes.
Wow. So there is hope that...
Yeah, there is hope. There is actually hope now, only that it's just not affordable and accessible.
Okay. I've come across a few classes that have made it, and I'm wondering, what usually motivates them? Because very many parents have lost hope. Very many parents who have children who are sicklers have actually lost hope.
Yes.
And some wish their children died.
Yeah, true.
How
Because of
best
the
do you
pain.
advise such parents?
We have footballers, we have doctors
Who are sicklers?
who are sicklers, and they've made it. And those are the ones that are inspiring others. And that's why whenever we, tell them, look, if you break today, you actually break that 3-year-old warrior. She won't have an inspiration, someone to look up to. You understand? So there are these stories that actually inspire other young warriors to stand up. For us, we want to speak on their behalf. We want them to speak now because they're now grown up. We want them to speak up. At least by then we say, oh, how will they look at me? I have sickle cell and I'm talking about this. Now they can speak for themselves. We are here to speak on their behalf, but now they can speak for themselves. We want to inspire more to speak on their behalf, for themselves.
Yes.
You understand? So, an inspiration where they pick and get inspiration is from those stories of resilience, those stories of professionals who have made it. So we have professionals who have really made it, and they have sickle cell disease. We call them sickle cell warriors because they are fighters.
That I have learned.
Yes.
But on average, okay, do you think that these that have lived their life now, is there still an age limit to their life?
To their life. Now, what I can say is that confidently, they can live up to 90 years, provided they get good quality care.
Even when they get these episodes?
Yes. They need to get good quality care. And it should be all round. Oftentimes, see, there are things that actually, now we see with the sickle cell warriors, there are things that actually, cause the crisis or attack, and some of them don't recover from them. You
Things
understand?
like what?
Hey, love. We just talked about love.
A heartbreak?
Yes, a heartbreak. Stress
can
alone is
cause
going to
it?
cause the crisis.
Wow.
You understand? Now, this girl is thinking about this guy, and this guy is like, no, I cannot keep you. You have sickle cell disease. You've been rejected. How do you handle that? Pain alone, psychological, torture itself. Dealing with rejection. Dealing with the chronic illness you're having. So you think about all that stress comes in, and you get into a crisis. Yeah. So some of them don't actually recover.
Oh dear.
Yeah, some of them don't recover. Yeah. So some of them have been rejected by their parents.
Yeah.
They're on the streets alone,
You can imagine.
hustling, figuring out life. You understand? So it's just hard, on them that they can't do it. But if they can get quality care, good quality care, they can live up to 90 years. They need to rehydrate. They need to have food rich in all nutritional values. Yeah. They need medical care. They need home care. They need siblings to to love them, to care about them.
Yeah.
Some of them say, "Twako wadda, mana tawanyiza." So many are rejecting these warriors, and it's not good. We need to embrace them as our sisters and brothers.
Nekati mama ali mu kyalo ayina abaana abali sick with sickle cells, and you're saying quality care. Quality
Even in the
care.
village, there is quality care. Yeah.
I feel like that requires a lot of money.
Quality care does not actually, front money. No. You see, we have like home-based care packages. We train our caregivers
Okay.
to prevent these children from getting crises.
Oh, really?
Yes.
You can prevent a crisis?
Yes. You know what are the things, the factors that cause these attacks?
You talked
One,
about love.
yes.
How can
How
you
do you
prevent that?
how do you talk about that? Now, love will come in, but now we are talking about the early stage. Okay, the love will actually will affect only the adults, the teenagers.
Yeah.
Now let's talk of early age. Okay, early age. What do you do? For example, you know very well when you get into a very cold environment, cold weather, it affects them. Even very hot environment, it affects them. They get into a crisis. So okay, whenever it rains and it's very cold, please
Keep
have a
them
jacket, keep them warm. Okay, there are those actually whenever they eat like red meat, they get a crisis. So you try to avoid that. You understand?
Okay.
Yes. Ensure that they take the medication as prescribed every other day without missing. Okay? We are preventing further crises. Then ensure that they eat food rich in all nutritional values. Now things like, for example, food that is rich in iron, so that they can have boosters, in their body system.
That is like silverfish?
Silverfish is actually very healthy for sickle cell warriors. Yeah, it's very healthy. Though for me, I don't eat silverfish.
But you're not a sick one.
No, it's not. I'm not saying that is only for the sickle cell warriors. No, because people may think that because I'm not, That's why I'm not eating it. It's for only those, they'll start leaving Mokene. No, please eat it. It's very nice. You need to look at also stress factors. Even those kids get stressed.
Yeah.
They don't see love. You're always away. Mommy is not there. Dad. So they think about it like when they get a crisis, no one is there to attend to them. You get. So we need to look at how we can prevent some of these, factors that are causing attacks.
I want to believe that's like maybe 1 to 5 years old or before 13. How about a baby?
Yeah, a baby, a baby who doesn't talk,
Yes.
you can't tell. The baby will be in pain and
you
will just
may
cry.
not know.
You may not know. And that's why you say exclusive breastfeeding, it's very key here. Because that's when you can tell this baby is not okay, this baby is having flu, this baby is overcrying. Maybe she has, an infection. Maybe she could be having, a complication, and you take her to the hospital. Remember, this baby will not talk, will not tell you anything. So you have to do what? To take her to the hospital for a checkup. Yes.
Now, so for a parent who does self-medication for a child, are there low chances for this child to survive?
One, professionally it's not advisable, medically it's not advisable to do self-medication, okay, unless guided by the doctor, okay, that this is how you should give this baby. You may give a very good drug for a wrong condition.
Exactly.
You understand?
Especially for a mother who does
So
child
maybe
is sick.
the kid is in a crisis as a result of anemia, you're giving Coartem, which is for malaria, and the baby does not have malaria. You understand? Why are you giving that? The baby is in a crisis because of infection. You're giving cough syrup. You understand? You're giving antibiotics when it's not. So that's why we normally say when the baby is unwell, rush them to a nearby facility for a checkup to be seen by the doctor. Then the doctor can advise accordingly. Yes.
Mr. Okello, for someone to be a part of your foundation or
Yes.
a suffering parent or a sickler
Yes.
who would want to get some help from you, what do they do?
You can reach out. You can reach out to us. We have email at director@raisinghopeinternational.org or info@raisinghopeinternational.org or 0779 62 59 32. I can repeat.
Then you can also, because a few people actually are so much into
Yes.
doing Instagram,
Yes.
Facebook.
When you check, yes, we do. We have the social media is very active. If you actually go on Google and type in Raising Hope International Friends, you'll get resources about what we do and every detail that you would love to know. And if you want to be a volunteer, to be part of the work we are doing, you will just fill in a form and you will get a detail. Then we'll reach out to you and see how we can support and work together.
And people can get free medicine from you.
Yeah, we offer free medication like the drug refills whenever our partners send in those packages. But at the moment we do not have them. However, we have the facilities like I said. We have the hospitals, health facilities that we work with that provide free, like Whispers Children Hospital in Ginger. We work with them. We have a partnership with them. They provide free sickle cell services.
Or anybody can walk in.
Any child below 13 years will get free sickle cell care. Even drugs are for free.
Really?
Yes.
Okay.
Then for adults, children above maybe 13 years, they have some small monies they pay to get some more care because we need to sustain this program.
Yes.
There are many warriors who need support.
Sure.
If we give for free everyone, tomorrow we may not have support for others. So that's why we're saying, hey, how do we sustain this program? At least you can make some small payments so that we can sustain. And for those who are in need and they have not gotten this kind of support, they can get it as well.
But for the screening, it's for
Screening is for free.
free.
Testing is for
In
free.
these hospitals.
In the hospitals is not free.
No, you don't.
For us, for us as Raising Hope will provide it for free.
Here in Kampala, you have a
Yes.
facility where
Yes.
someone
Here-
can go for free screening.
Here in Kampala, you can come to our offices in Intinda at Haruna Towers.
Haruna Towers.
Yes.
Anybody can walk in.
Yes, you can walk in. and get free service.
When do they get those results?
In just 10 to 15 minutes, we'll have your results ready. Free of service.
So can anybody come, or you must be sick? Can anybody walk in for the tests?
Yes, anybody. It is free for everyone, every Ugandan. Yes.
No
You
free
don't need to be.
things, and the line's so long.
No. We actually now, what we do, we have set a day for only screening. The rest of the day you can come in and make your inquiries. But Thursday is dedicated for screening. So you can come on Thursday and screen.
Those are
It
the
doesn't
long
take-
lines.
Not really long. Not everyone comes. Many people prefer the outreach, outdoor activities.
Like
Yes.
when you go and camp somewhere.
Yes. Like next month on 3rd and 4th, we'll be in Kamocha. So for those around town, they can come to Kamocha and get free services.
Where in
screening.
Kamocha?
At Catholic Church, Kamocha. Yes.
Wow, Mr. Okello Isaac,
yes.
This has been so enlightening. I know very many people out there who didn't know actually how serious this disease is. They've picked a leaf or the whole tree. Thank you so much for your time.
Yes.
Thank you for sparing some time with Elevated. Hope to have you around for the next session.
Thank you so much for having me. And for the viewers, thank you so much for being part of this program.
Thank you. See you later in our next episode. Bye for now.